Welcome back once again to my channel. This is Isoa. I'm a YouTuber based in Owerri, Nigeria. Guys, if you haven't seen my face before, please, before I go into any other thing, subscribe, okay, because this is a valid information, okay? And turn on your notification bell. Give this video a thumbs up. Don't wait to see if you will like it, because you're definitely going to like it. Give it a thumbs up. I'm waiting. Okay, thank you guys. This video I'm sharing today, I want to share with you guys how you can practically give birth to either any of the secondary or tertiary healthcare system in Nigeria. Yes, in Nigeria, with virtually zero kobo. Let me just put it out there. I have tested this and it still baffles me why I haven't shared this content, though I've mentioned it in one of the videos I shared 2020, the year I started YouTube. I mentioned something like this, yes, but I want to give it out today as a content. If you're in diaspora, you have an elderly person, or you have your younger ones always on you. I'm not saying you should not give them money, always on you. You know, we have this mentality that you guys pluck money from trees, so we ask you for money for water, money for health, money for food, money for this. So this is a route you can follow to save yourself money. I have used it. I don't know if I've mentioned it. If you're an old subscriber, you must have heard me say, when I gave birth to my twin girls through cesarean section, through operation at the Almighty Federal Medical Center, the fee, discharge fee, everything they gave me was 2,800 2,800 naira, not dollars. So, and this is something that I found out that the Nigerian government are not like spreading it. I don't know if it is that they don't want people to use this platform, or is it that I don't know why the awareness is poor. Let me put it out that way. So I'm sharing this content today on how you can book or register for this insurance and be able to choose hospital that you want to go to. It's not like you can choose hospitals that you want. It's not like it's a substandard place you can go to, and no. One of the tertiary or secondary level of healthcare system you can choose to be going to, and you will be attended to. Let me tell you, I'm going to tell you the pros and cons. There are little cons to it, very little, minimal. So okay, I actually called the person that helped me that year. I must give credit to one of the nurses at FMC. So when I gave birth to my son, I didn't know about this insurance, and this video is not sponsored, guys. Please, it's not sponsored. So when I gave birth, I know how much we paid, huge money, going through IVF and cesarean section, which was an elective surgery anyway. So when I was pregnant with the twin girls, I think the first day I went to the clinic, the FMC, to register, the nurse was like, I hope you know you're going to deliver through cesarean section. I was like, oh, with all pleasure, I already know. She said, have you registered? Are you on insurance? I said no. She now told me about it. I was like, okay. So I came home, I asked my neighbor who works there too. She gave me full details about it and told me where to go to. And I went there and I registered for 15,000 naira. And I must tell you guys, I mentioned that here equally. My son at 9 months was diagnosed with tonsillitis. Yeah. So, and they kept managing him. I registered him. I paid that same. I think then kids were 6,000 something, but I mistakenly paid 15,000, which was never refunded anyway. So, at the long run, my son had to go in for surgery, tonsillectomy. My brothers and sisters, the fee they gave to us after the surgery, the drugs, everything that we paid for my son was 5,200 naira. I went to the guy, I called him and to get information on how to still do this, and he gave me full details. I'm going to be reading them out here because this thing has been long. He gave me this information. I've actually forgotten. Merenga, no great. So anywhere in the country, before it was called V-Ship, but he said now that it's called Gift Ship. Okay. So, and he said it's a social health insurance. Okay, they're in different categories, and the first category 1, is called individual, but that individual is 3 persons. is 1 to 3 persons, you pay 45,000 naira, and this thing lasts for 1 year. That's if you register for 45 with the 45,000 naira, you are going to put 3 persons name. And in case if you don't have 3 persons name, you can still register yourself alone, but the downside is that you're going to still pay the 45,000 naira because it's in category. Then the category 2 is called family, which is 4 to 9 persons. So if you want to put your grandfather, grandmother, everybody to make it that 9 persons, you put, then what you will pay is 60,000 for 4 persons. Then each person you add is 15,000. I don't know if this is clear. 60,000 for 4 persons, that is in category 2. Then whenever you want to add another person, you pay 15,000, but it has to be it has to be between 4 to 9 persons. Then the category 3 is 150,000 for 10 persons. This is what he gave me here, for 10 persons. Then so the next thing he told me was that the waiting period is a minimum of 90 days. That's like 3 months to process it, because when they collect from their different states, they send to the zone, from zone to the federal level. Before they process it, can take up to 90 days or even more. But the good side is that whenever it comes out, that's when they will start counting for you. That's when you start assessing them. It's not like you register now, they are bringing it out in the next 5 months and telling you it has already started reading. No. Okay, then the next thing he said that you are not entitled to surgery the first 6 months of your registration. That is to say, if your document comes out today, you start going in for you start assessing the healthcare system at close to 0 naira. So you are not entitled to surgery until that program which you have started 6 months has passed. That is to say, if you're ready, I'm making this video in February, I don't know when I'm sharing it. If you register in February, everything comes out in February. That is to say, by February, March, April, May, June, you will start assessing, or you will stand the chance of going in for surgery under this platform, under this program, in 6 months time. Then you are entitled to x-ray from day 1, you are entitled to scan, you are entitled to vaginal delivery expenses, antenatal, anything that is within the coverage of what you registered for, you are entitled to it, except surgery. Like when I heard of this, when I was pregnant with my girls, this law wasn't there then anyway, but I quickly registered and I used I enjoyed everything about it without paying money. Okay, then let me finish before I say then the requirements. You have heard of the money. Come with the money to their office. If you want me to give you the guy's number, if you are in Imo State, Owerri, then I'm going to give that out. Is it going to be free? Information is not free. So requirements, you just come with the money and the passport of the people you're going to register in the category. That's all. So that's all. But the downside, let me now explain my own honest review about this. If you have people who need special care, what I mean by special care, you have elderly people, maybe they are down with diabetes, all these non-communicable diseases like chest, things that you need to see a specialist, then you need this whole process. You need this, because if you go to some of the hospitals, they will still refer you to this consultant who does these jobs, who does this, handle these cases in higher level of healthcare system. I hope you understand. Then you need these people. Another group is that if you think you're financially down, you cannot be able to be paying thousands anytime you go to hospital, covering the drugs and all that, you need to assess this. But the downside of this procedure or this program is this: if you are not patient, generally it's not about being patient. Any hospital you go that does this, handles this insurance, you have to be very patient. Whenever you're going, go early so that you'll be attended to. Even when you have your money, like FMC, I've said this several times here, nobody is going to beat me. Even if when you have your money, FMC is not a place you go and say, let me pay express and go. Nobody cares if you have money. So you still have to be patient to follow the Nigerian healthcare system. That's how we see it here, okay? The next downside that's more like standing out is that most of the times, or let me not say most of the time, is that sometimes they will tell you the drugs that are supposed to be given to you is out of stock, or maybe they are giving you Nigerian brands of that particular drug. That is, if they are supposed to give you something like Augmentin, and Augmentin is a foreign, I'm just using it as an example, it's a foreign drug, they will give you the same parent name, probably Nigerian make. So it is not left for you. It's not as if they are not going to be helpful, they are not going to treat whatever the ailment, but you know, this our mentality of, if you give me Augmentin, you have solved the problem. That is the final bus stop, which is a misconception, I must tell you, but it is what it is. I think this is the only thing I have been. And another downside is that be ready, mostly if it has to do with pregnant, delivery, cesarean, be ready to work from office. Just have people around you to be doing all the waka waka, because it was not easy. It was not easy, even at a point, because of the situation that I went for an antenatal that day, and I was taken into the theater immediately. So I was like, and my husband wasn't around, it was just my driver and my friend Oyibo. I just gave the driver money, please forget about this thing, go and pay, go and buy the drugs and let them take me in and all that. So you have to be ready and have people around you to do the lot of waka 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 waka. But above all, it is a very good means of saving money. You're not going to, the consultation is free after you have paid this money. There is nothing like paying money. The drugs are mostly free, unless if the one that are out of stock, they will tell you to go and buy outside, which I don't see anything bad about it. So this is the video. This is how you can practically access healthcare system in Nigeria for close to 0 naira. Okay, if this video is important, please do let me know in the comment section. And if you haven't subscribed, what are you waiting for? Subscribe now. Okay, thank you so much, guys, and share with your friends and loved ones. You never can tell who needs this information, who may be able. People are going for surgeries and paying 300,000 and above, and here I am giving you a clue on what to do in order to pay not close to 0 naira. Okay, thank you so much, guys. Subscribe and share with your friends and loved ones. Thank you. And this applies to Nigeria generally. So he said the name is Gift Ship Social Health Insurance.